In 2023, Bilal et al. Conducted a study among 221 Sudanese adults in Khartoum state, which is the capital of Sudan. This was at the start of the war, maybe 4 months after the start. Their ages range between 35 plus minus 11 years. It highlighted the significant prevalence of depression, which moderate severe depression was 25% and severe depression was 62, while moderate anxiety was 36% and severe anxiety was 52. In our study, we investigated depression, anxiety, in addition to post-traumatic stress disorder and insomnia, among Sudanese citizens in all states, after a year has passed since the start of the conflict. We mainly wanted to know the long-term mental health effect and the effectiveness of intervention received community resilience. We used an observational cross-sectional study methodology. We conducted the study among Sudanese citizens inside and outside of Sudan. Our data collection started in March 2024. We used Google Form and then shared the link through social media outlets such as LinkedIn and X, formerly known as Twitter, Facebook, and we targeted Sudanese community groups and we designed the form to be engaging, user-friendly, and culturally sensitive. Inclusion criteria included being a Sudanese citizen who spent at least one day in the war-affected cities, and we excluded individuals already with a diagnosed mental disorder. The questionnaire was conducted in Arabic. We received our ethical consideration and approvals from the Ministry of Health in Khartoum. The questionnaire structure included 5 sections. Number one, the demographic data or participant characteristics, including age, sex, marital status, education, job, family size, and war trauma experienced. War trauma such as hearing bombing or shelling or gunshots, physical abuse, knowing someone who had died due to the war is also considered a trauma, armed robbery, and so on. We also assessed the depression using the patient health questionnaire, 9-item scale, anxiety assessment using generalized anxiety disorder, 7-item scale, post-traumatic stress disorder assessment using the PCL-5, which is part of the DSM-5, the diagnostic manual for simply to just diagnose psychological problems or mental disorders. And finally, insomnia assessment using the ISI or the index of insomnia, severity of insomnia. Our study included 283 participants. Their ages range from 21 to 65 years, and 76 were females, 50% were married, 50% had a university level of education. Length of stay in the war zone ranged between 3 weeks to a little bit less than 4 months. Of our participants, 56.5 had post-traumatic stress disorder, 91.5 had depression, 95.8 had generalized anxiety disorder, and all of them had insomnia. As mentioned earlier, there was another study that was conducted around 4 months after the start of the war by Bilal et al. Now, when comparing these findings to our findings a year later, moderate to severe depression increased 25.3 to 50. Severe depression declined from 62 to 18%. Post-traumatic stress disorder rate significantly rose from 24.9 to 56.5. Subthreshold insomnia showed a slightly decrease from 57.5% to 53. Previously, mild anxiety disorders was the most common at 33.9. In our study, moderate generalized anxiety disorder was the most prevalent at 35.3. The war trauma, we separated this in two parts: experienced by the participant themselves or experienced by someone they know, such as a family member, a friend, or an acquaintance. The most prevalent was sound of gunfire and bombing. 83 of the participants experienced this, and 100% of the participants know someone who had experienced it, followed by 72% of deaths. simply saying that 72% of the participants had someone they know who died due to war directly or indirectly, such as bombing, shelling, and so on, or lack of access to healthcare, lack of access to medication, lack of access to food and clean water, and so on. Armed robbery was the following when it comes to prevalence. It was also very, very high. Other war traumas included verbal abuse, gunshot or bomb wound, physical abuse, sexual abuse, rape, and verbal abuse. There was a significant correlation found between the length of war and insomnia. So the longer stay in the war zone actually caused less insomnia. Being married was associated with lower depression and lower anxiety. This has been known in the context of war outside war that being married is protective against mental disorders. In addition, higher education was related with lower depression and anxiety, but higher education was also related to higher PTSD incidences. Our findings showed that 63.3% of the participants received no mental health intervention after leaving the war while inside Sudan, while inside the affected cities. The remaining 36.7% did not respond, implying that maybe all of them had not received any mental health intervention. This is a very alarming gap in care. This is why we conducted this research, because we want to know um, the areas that we need to work on. Limitation of in the study included the use of self-reporting tools. Self-reporting tools means that the participant themselves, they reported, I have these symptoms, I have this sign, and so on. However, they were all previously validated. But again, it is not compared to having assessment done by a professional healthcare provider. The war reshapes not only the land or the country, but also the human mind. As resilience is tested, so too is the need for compassion, healing, and unwavering pursuit of peace. These are some of the most potent references we used. Thank you so much. My name is Sahar Elnour. I'm a family physician from Mina Health, Riyadh, Saudi Arabia. And thank you so much for the opportunity of presenting. Any questions?